The information in this video is based on up-to-date evidence and expert opinion at the time of its recording. It is intended to complement, not to replace, appropriate training and national and local guidelines. We hope you enjoy the St John's Derm Academy Dermatology Education video on Curettage and Cautery, intended for healthcare professionals. The first step is to identify the lesion to be treated. Curettage and Cautery by 3 is a therapeutic procedure that is most commonly used for superficial basal cell carcinomas, benign keratinizing lesions, or select pre-malignant lesions such as Bowen's disease. Before starting the procedure, perform a pre-procedure check and ensure informed consent has been obtained. Establish a sterile field. Using a surgical skin marker, outline the lesion with a dotted line, and if needed, add a small clinical margin of normal skin to ensure adequate removal of the lesion. The margin is usually 2 to 3 mm depending on the clinical diagnosis. Infiltrate local anaesthetic beneath and around the lesion. There are several ways to approach a Curettage and Cautery by 3. I prefer to perform a small shave biopsy first and send that to histology, as it is easier for the pathologist to diagnose compared to sending tissue fragments gathered from a curette. Not all dermatologists will perform this step. Hold the curette like a pencil in your dominant hand, with the skin under gentle tension from your non-dominant hand. Then apply firm, controlled strokes to scrape the lesion. Continue curetting until the tissue feels firm under the instrument and no obvious friable tumour remains. The curetted tissue should be collected for histology if indicated. Continue this motion, ensuring that you curette in all directions. It is important that you only use the blunt end of the curette. Tumour tissue is friable and it should peel away from the healthy dermis. The sharp end of the curette doesn't make use of this difference in friability to either identify the margins of the lesion or minimise the amount of normal skin damaged. Once curettage is complete, hemostasis is achieved using electrocautery. Select coagulation with the lowest setting that can achieve hemostasis. Apply the tip to the curetted area across the entire surface, and avoid using cautery on healthy edges, as this may increase scarring and delay healing. The procedure is to perform 3 cycles of Curettage and Cautery, as documented cure rates assume this. Less cycles is equivalent to a shave and cautery, which may be a more appropriate procedure. Following hemostasis, apply Vaseline and a clean dressing. Provide the patient with wound care instructions. Healing will occur by secondary intention over 2 to 4 weeks, depending on the size of the lesion and location. Patients should be advised about possible hyperpigmentation, scarring, or recurrence, and the patient should be reviewed if healing is delayed. Thank you for watching. If you found this helpful and want more videos on skin surgery techniques, including biopsies, suturing, and other dermatological procedures, please see the description box for links to our educational content.